Welcome to Dr. Health Hub, where every episode begins with a doctor tip you can trust. Today we're talking about back pain. Almost everyone feels back pain at some point, but many people are scared it might be something serious. Is it just a muscle strain? Is it a slipped disc? Could it be cancer, a spinal infection, or an autoimmune disease? Let's walk through this slowly and clearly, like a real clinic conversation.
You're right, this is a very common concern. Most back pain, especially lower back pain, is what we call mechanical. That means the pain usually comes from muscles, ligaments, joints, or discs that are strained or irritated. It can hurt a lot, but in most people it improves over days to a few weeks with movement, gentle activity, and basic care. There is also a smaller group of patients with more serious causes of back pain, things like a fracture, cancer spreading to the spine, a spinal infection, including tuberculosis of the spine, sometimes called Pott's disease, or severe nerve compression, such as cauda equina syndrome. Our job as doctors is to work out which type a person has.
So, if someone wakes up stiff after lifting a heavy box, that sounds more like the common mechanical type of back pain.
Exactly. Mechanical back pain often appears after a clear trigger, lifting something heavy, twisting quickly, sitting for long hours at a computer, doing new exercise without warming up. The small joints and discs in the lower back get irritated. The muscles around the spine tighten to protect the area. It's painful and annoying, but in many people, the nerves are not permanently damaged and there is no serious underlying disease. Gentle movement, short walks, using heat, and simple pain relief, under medical guidance, usually help.
But many people are scared of missing something serious. They keep asking, when is this not normal? When should I go to the hospital right away? What are the red flag signs you worry about as a doctor?
We pay very close attention to those. Red flag signs are warning signs that there might be a serious cause, such as cancer in the spine, a fracture, a spinal infection like TB of the spine, or severe nerve compression such as cauda equina syndrome. Our job as doctors is to work out which type a person has. You should seek emergency or urgent care immediately if back pain comes with any of these. First, new trouble controlling your bladder or bowels. For example, leaking urine, not feeling that you need to pass urine, or losing control of your stool. Second, numbness in the groin or the area that would touch a saddle when you sit on a horse. Third, severe or quickly worsening weakness in one or both legs. These can be signs of cauda equina syndrome. That is a rare but true emergency where the nerves at the base of the spine are compressed and need fast treatment. You should also get urgent medical evaluation if you have fever, chills, or feel very unwell together with back pain. We worry about infection in or around the spine, including tuberculosis, especially in regions where TB is common. You recently had major trauma, for example, a fall from height, a road accident, or a big injury. We worry about a fracture. You have a history of cancer, unexplained weight loss, or back pain that wakes you from sleep and does not ease with rest. We worry about cancer involving the spine. Those situations are not wait and see next week. They need medical care quickly.
Another thing patients ask all the time is, do I need an X-ray or MRI right now? What do major guidelines suggest about imaging?
That's a great question. Most major medical guidelines agree on one key message. If someone has new low back pain without red flags, routine imaging is not recommended at the beginning. Instead, we start with a good conversation and examination. We ask when the pain started, what makes it better or worse, and how it affects daily life. We check movement, strength, reflexes, and feeling in the legs. We usually reserve X-rays or MRI for people who have red flag features, or for people whose pain does not improve after several weeks of good treatment and rehabilitation. The idea is simple. We use imaging when it will change the treatment plan, not just to look and create more worry.
So, you also mentioned autoimmune causes, the inflammatory type of back pain. How is that different from the usual, I hurt my back at work story?
Inflammatory back pain behaves differently from simple mechanical back pain. It is strongly linked with autoimmune diseases that affect the spine, such as axial spondyloarthritis and related forms of arthritis. Typical clues include it often starts before age 45, it lasts more than 3 months, it is worse in the second half of the night and early morning, it improves with movement and exercise, not with rest. There may also be a history of eye inflammation, psoriasis, inflammatory bowel disease, or a family history of similar problems. When we see this pattern, we think about autoimmune or inflammatory back pain. In those cases, we usually involve a rheumatologist. Early diagnosis and treatment can help protect the spine and improve long-term quality of life.
So let's talk about treatment now. If someone has simple, non-serious mechanical back pain, what do major guidelines recommend?
Most guidelines share one very important message: stay as active as you safely can. Long bed rest usually makes back pain worse, not better. Short periods of rest are sometimes okay, but lying in bed for days tends to slow recovery. For acute and subacute low back pain, non-drug treatments are often the first step. That can include warm packs or heat wraps, gentle activity and stretching, and guided exercise or physiotherapy. In some settings, people also use massage, spinal manipulation, acupuncture, or mindfulness-based approaches, depending on what is available and comfortable for them. If medicine is needed, doctors may use pain relievers like anti-inflammatory tablets, or in some cases, a short course of a muscle relaxant, always checking the person's kidney, heart, and stomach risk first. For chronic back pain, pain that lasts more than 3 months, guidelines strongly support regular exercise, core strengthening programs, activities like yoga or Tai Chi, and sometimes psychological or mindfulness-based strategies. A team approach with several professionals can help when pain has been present for a long time. Strong opioid medicines, if used at all, are generally kept for very selected cases and are closely supervised.
Before we close, can you give viewers a simple do and don't list for back pain?
Of course. First, the do's. Do stay gently active if your doctor says it's safe. Short walks, light stretching, and avoiding long hours in bed usually help your back recover. Do watch for the red flag signs we talked about: problems with bladder or bowels, groin numbness, weakness in the legs, fever, cancer history, or major trauma, and seek urgent care if they appear. Do work on long-term habits: good posture, regular exercise, safe lifting technique, not smoking, and keeping a healthy body weight. These all reduce the risk of ongoing back problems. Do follow your clinician's advice about tests, treatment, and follow-up, especially if there is concern about cancer, spinal infection like TB, or autoimmune disease affecting the spine. Now, the don'ts. Don't ignore back pain that is very severe, new and different, or linked with fever, weight loss, trauma, or nerve symptoms like weakness or numbness. Don't stay in bed for days waiting for it to pass, unless your doctor clearly tells you to rest. Don't take pain medicines every day for weeks without medical supervision. Those medicines have side effects and can create new problems if used incorrectly. And don't rely on random herbal pills or online remedies to treat serious back pain, especially if there is any concern for cancer, spinal infection, or autoimmune disease affecting the spine.
So if we had to put today's message in one sentence, most back pain is common and treatable, but serious causes like fracture, cancer, spinal infection, or autoimmune disease do exist, and the red flag signs are there to help us catch them early.
Exactly. Listen to your body, respect the warning signs, support your back with movement, strength, and healthy daily habits. And remember, everything we've shared today is general education, not a personal diagnosis or treatment plan. If you are worried about your back pain, especially if you recognize any of the red flags, please see a healthcare professional in person.
Thank you for that doctor tip you can trust. And thank you for watching Dr. Health Hub. Don't forget to like, share, and subscribe for more trusted health tips. Take care of your spine, keep moving safely, and remember, your health is your wealth. Stay tuned for the next doctor tip you can trust.